Welcome to Orthopod, a podcast about the people of orthopedics and their stories. We understand that we all play many roles in our careers and lives, and it is these very stories that ultimately inform our successes and failures. Hey folks, it's Mo Bendari from Orthopod. Welcome again to another show. We're going to talk today with three individuals about graduate school and benchmarks for graduate school. It's becoming more and more important, and the questions we get asked lots more than we used to is, do we need graduate school to be successful in orthopedics or musculoskeletal research in any meaningful way? Or can we get by with appropriate mentorship and training? So today in studio, we have Kim Madden, who's an associate professor in the Department of Surgery. Kim's completed her PhD recently and has been taken on this position at McMaster University for the last year or so. We also have Mark Phillips, who is a graduate student. He's transferred from his Master's of Science to his PhD and is also doing research in musculoskeletal area. And then we have an orthopedic resident who is contemplating, and I believe will be considering doing his master's, has just been accepted into a master's program, Sepper Akhtiari, who is an orthopedic resident at McMaster University. Hi folks, how are you?
Good, thanks.
So here's the debate. The debate is, do we need graduate training to be successful in research? And I'll start with you, Sepper, simply because in orthopedics we get the debate. In orthopedics we've seen tons and tons of literature that says that there is a declining species called the academic surgeon. And then there's requisites in most programs around the world where trainees should be doing some degree of research. At McMaster there is a research expectation, and one would say that many more people graduate orthopedics without formal research graduate school, and may go on to work in academic centers. So why do we need a master's or a PhD?
So I think for me, one of the big things about deciding to do a graduate degree is having formal training in the steps to doing research properly. And I think a lot of those things are, you can learn them on your own, and you can learn them through mentorship, but to have the opportunity to actually dedicate time to it and learn it, it's the same way that we dedicate 5 years to learning how to do every step of every specific surgery that we need to learn to do. I think if you want to be able to lead big studies and big clinical trials, that it's important to know the steps that go into that and to learn them properly from people who have experience in that, rather than just flying by the seat of your pants.
Right. So it used to be historically, you can graduate without any orthopedics, for example, without any graduate level training, and you'd go on and do research, and you could be highly successful. Prior to you getting in, so you haven't started formally your master's program, how many publications or papers have you been involved in?
About 30.
30, right? So clearly one would argue, well, you're doing pretty well without it. Your hypothesis though, and maybe Mark or Kim, you can speak to it, do you think that Sepper is likely to get better at doing research? Is the quality of his research going to get better? He's got 30. He's demonstrated he can publish. He's demonstrated he can do all this. And this is the real debate that happens, right? Because do we need to be setting a new threshold for how much research training you need, and what is the absolute added value of graduate training?
For me, it's less about the formal classes. They help a lot to sort of consolidate knowledge, but actually having those 2 years, 3 years, 4 years set aside to actually have protected time for research is really what did it for me, more like an apprenticeship model. In 4 months you can learn to do a pretty good systematic review, and then you can do systematic reviews for the rest of your life or whatever. You get better at them as you go along. But when I was working full-time in research, I had, 7 years with you or something, which was those 7 years of protected research time. I learned how to do multi-center randomized trials, something that you wouldn't have a chance to do if you were just doing a project here and there. So I think it's less about quantity of papers and more about the quality and depth that you can get from that experience of having that time set aside.
Yeah, I was going to say you can certainly sort of go about it without graduate school, but the one thing that you really learn is the bigger things like big trials. There's probably a practical barrier to obtaining funding and those type of things if you were to embark on trying to do a trial on your own without any formal training. It's probably going to be a practical barrier to that. as well as just sort of the nuanced types of issues that you're going to come up with are things you'll learn in graduate school to address.
Okay, but is that enough for someone to say, I'm going to spend the money, right? Because you're spending, I don't know, how much does it cost for graduate training per year? On average, let's say in the Canadian system, your tuition's 4,000 or 5,000, 3,000?
I think it was
8.
5,000 for master's, 7,000 for PhD.
Okay, so
Six or
right.
7,000.
So that, and you're looking at multiple years, right? So it's a fairly reasonable investment of time and of cash flow out. Does it actually lead to a better situation, right? And is it mandated? So I think the point that you brought forward, Kim, is, having additional training letters is important because it gives some degree of assurance to others that, hey, they've been through the principles, that they know the building blocks of what it takes to do research, and they've at least been exposed to it. Can they do it? No one knows. You can graduate with a master's or a PhD, and quite frankly, never have done, as you said, a big trial, right? Happens, in fact, more common than not. But do you have the building blocks to do it? The argument is, you need to have the PhD to still be able to do trials. There's many more people doing trials without PhDs than there are with, right? And this gets back again to the debate around hiring individuals. Some programs have made it mandatory that we won't hire faculty without a minimum of a master's. You may have heard of that. McMaster's certainly has a general interest in this area. University of Toronto, for an example, has an interest. And I think there are many, many other programs, both in Canada and internationally, that have that same sort of branding. So once again, what is that skill that we're picking up that you couldn't just get from spending 7 years with someone or 5 years with someone?
I think it's an important point, and I think that I have students who ask, who are getting involved in research at the med school or undergrad level, and they ask, how much research do I need to do? Should I be doing research? And to me, the way I look at it is, if it's something you're interested in and you're motivated about, then you're going to make the most of it, and you will become better for spending the time. And so, I'm doing a master's in clin epi because I'm interested in that, and because eventually I hope to be in a position where I'm involved with large trials down the road. Right. But people can do masters in other areas if they're more interested in those things. Right. And so I agree. I don't think it should be, I'm doing residency, I want a job, so I have to do this specific master's. Right. I think definitely what you don't want to do is work to the test or work to what's expected. I think you should figure out what it is, that you want to do as a general point. But let me ask you this, if I can put you on the spot, Sepper, again a bit. So you've been pretty prolific for a trainee. I'd say, the average trainee in orthopedics over their 5 years might have 1 or 2 papers, right? If you look across all programs around the world, that's, it's about, the median is between 0 and 1. So to have 30 and you're in your second year, right? So you're likely on track to have 50 some odd papers before you graduate. The 30 you have done, what would be the primary approach to research that you've used in those 30 papers? So systematic reviews and meta-analyses. Okay. So I think, systematic reviews and meta-analyses are what I believe are the modern day case series, right? Prior to 10, 20 years ago, most graduate trainees, when I was in orthopedics in 95, 94, when we got in fact, the majority of our academic day presentations were case series, series of X number of patients, and they were thoughtful reviews. Really what I think we've progressed to is the systematic review, which is often of case series, it seems these days, the review of choice. Nothing good or bad about it, but that's just what's happened, right? So do you feel you're confident or capable and you need additional training to get you to do other things, or could you just work with a group and get that experience? So for me, I think the experience I've had has been invaluable in learning some of those basic skills and really learning how to look at literature critically. And so when I'm doing these systematic reviews, meta-analyses, when you're dissecting each paper and trying to understand whether or not it fits in with your review, whether or not it's high quality or not, you understand some of those basic principles. But like Mike was saying, I think to take the next step and to actually try and move on. Well, let me ask you this. Let me just ask you point bluntly, and you can jump in. Is there a ceiling
if your career is just doing meta-analysis and systematic reviews. And I've done a lot, so like I'm not saying negative things to those who do them. I think they're wonderful, they're great tools. But if that is your primary focus, do you have a ceiling going forward?
I mean, I think
in terms of your ability to progress academically?
It depends on how you go about doing it, because you have the grade group at McMaster, for example, who is doing really, really excellent, like world-class, high-impact systematic reviews of large trials, and they're using the grade approach to, gain credibility, and then they're using that to put out practice-changing guidelines, ideally.
Right.
So that is one trajectory where systematic reviews will serve you very well. But if you are in surgery, we don't really have that many RCTs,
sure.
and we don't really have the meat behind it to kind of go in that direction, like
right.
internal medicine or cardiology would.
Oh, and I'm all with you, but I guess the point is, can you make a career, right, and continue to go up if that is your only type of publication you do in your career? So you could have 1,000 such papers. Are you likely to be more successful than someone who might have lesser number of papers but a different type of design? And the argument I'm trying to get to is, if you all believe that, and your colleagues believe that, hey, we can just write meta-analysis and systematic reviews and we can keep going. You can go from 30 to 50 to 100, and you continually have academic, and you continue to rise academically. You don't need a master's, right? You can do it now. Right? In other words, the additional knowledge you're gaining isn't necessarily going to benefit you to the pathway you want.
Yeah, I think you are to an extent, but I mean, it's obviously not a rule. But you are limited, or your ceiling is the trialists, because you're doing a systematic review. Say there's some novel topic in orthopedics that you want to look at. You can't really do a thoughtful systematic review that answers that question until trials start coming out.
Well, people do it with case series. So
do it with
But again, you guys are generally. I know you're just dancing around the question. Right? The question is, all you got to do is say, Mo, no, you can't. You can't make a career out of doing case series. You can't do systematic reviews. It's not the future. The future is not going to be great research is not going to come from case series of meta-analyses of case series, right? It's not going to happen.
So I think I agree.
Yeah.
I mean, I don't think great new ideas are not going to come from reviewing the same things over and over.
Right. So
I think the flip side of it is, practically speaking, could you work at an academic institution and mostly do systematic reviews?
Yeah, sure you can. Sure. We know lots of people. We know lots of people who publish, quote, another one all the time, right? Just another one and another one and another one and another one. Totally fine. That is your ceiling. I believe it, and I truly believe it. But I'm curious if that's permeated, because there's a difference between quantity and quality.
Right.
And I do think that even in meta-analysis, a single, to your point, Kim, meta-analysis of high-quality research, like really high-quality trials, can be highly impactful in directing where you're going to go. But we sometimes get blinded to volume, right? And so for all of you, I think it's wonderful that you guys are pursuing this, because I think it's really important to have the insight. I grew up probably doing, in my first 3 or 4 years, more systematic reviews than I probably care to think about, right? But the most impactful research I've ever done has nothing to do with systematic reviews, unfortunately. It just doesn't have anything to do with it. And you have to move forward. So I do think that there is this general movement that we have to be thinking differently and bigger. And I think that the more you can stay learning and the more you can stay involved in the experience of research. So as much as 3 letters after your name, whether it's an MSc or a PhD, matter, I think the fact that you're in a PhD, the letters are less important than the fact that you are now committed to a group of individuals like-minded in an environment that keeps you simulated and keeps you thinking. If you can have that environment without any degree, do it. Like I would 100% say, in my mind, just do it. But oftentimes, you need the protected time, and the only way to get protected time is to put yourself into a formalized training program that really forces you to think about these things that you wouldn't think before. Is that a reasonable assessment from your perspective? Have you experienced that in the last few minutes here?
Yeah, I would say so. And to the point of putting yourself around like-minded individuals, there's sort of this sense in our program, and anyway, I can't speak to other programs, but I think it's probably generally similar, is there's this sort of environment of collaboration, and you gain so much from working with others that are also have this similar mindset, opposed to trying to just squeeze in research on your own time.
Yeah, it's hard.
Priorities happen,
and when you put money into something, you feel accountable to it, right? I mean, it is, right? You gotta have what we say, skin in the game a bit, right? So you put some money into something, you do feel like you wanna, you wanna spend the energy and time, because now you're investing in your future to some degree.
Yeah, and I think just a final point on the systematic reviews and the meta-analyses is, I see them, it's a tool in your toolbox, right?
Absolutely.
And I think that they serve a very important role, but when they're done in the bigger context of setting you up for a trial or...
Absolutely, right. Oh, listen,
pointing out gaps in the literature.
We do systematic reviews all the time, but we don't do systematic reviews as a means to an end. It's a means to a new beginning and understanding a problem. However, last point, of the 30 systematic reviews you've done, how many have led to trials? How many trials have you pursued?
None so far.
Right. So the point is, do one systematic review, promote a trial, right? Like, systematic reviews shouldn't be an end, right? It should be the beginning. So I think on that note, we will continue this discussion. We got lots to talk about. So I want to thank Kim, thank Mark, thank Sepper for being in the hot seat, so to speak. And I don't think we resolved the issue, but I think we've made a little bit forward progress. So for all of you, happy research, and we'll be back again on another session. Thanks so much. Thanks for watching Orthopod. Stay tuned for more episodes.